This is the what every woman needs to know about breast cancer panel. We have 3 of the best doctors in the field to cover all the bases. But we also have Nicole Butte here, who's a recent survivor of breast cancer.
When you're first really going through it, there's this whole, as a patient, you're trying to kind of learn the system and understand and teach yourself, literally going through Cancer 101 on your own and trying to understand what exactly is going on in your body. You know, whether it was getting through my first chemo or, you know, getting through my tissue expanders. It was taking that moment and enjoying and just celebrating those little victories. And I feel like that was a huge lesson.
So number 1, just being female, having estrogen running around in our bodies is going to be the biggest risk. You know, secondly, age is the second risk the older we get. I mean, the chances go up, but clearly, as you saw with Nicole, you know, younger women also get breast cancer. But the things that you can change that can potentially affect or reduce our breast cancer risk, probably the 3 main things just have to do, number 1, with body weight. There's a lot of emerging data that suggests that being overweight does increase risk of breast cancer. So really finding what your ideal body weight is and trying to get down there and then maintain it. I think nutritional factors have a lot to do with it in terms of what we put into our bodies, because just living here on planet Earth, we are going to be exposed to tons of things in our environment that can increase our risk of any kind of cancer. So what can we do to kind of protect ourselves from that in terms of a dietary standpoint? And we're learning more about, obviously, about antioxidants and other things that can potentially be carcinogens that we should try to avoid. And then I guess the third thing would be more similar to just exercising and kind of just keeping, and that has to do with body weight as well. But being overweight and stuff also induces like a chronic inflammatory state in our body. It increases inflammatory markers. We know those can be kind of set up for cancers.
When I approach people who are, you know, what is really my risk? There are 2 groups. It's the hereditary group, so those who may already be sensitized because they have a family history, and it may be of breast cancer alone, it may be breast and ovarian cancer, like Nicole was mentioning, related to, you know, certain genetic susceptibilities. It may be less obvious. It may just be seems like there's a whole lot of cancer in the family. So all of those are sort of benchmarks to say, hey, I really need to look into this a little bit more. Is there something that I can define my risk better for myself, for other members in my family? Then we have the all-comers, sort of the sporadic breast cancer. And what we've learned in terms of the hereditary group, so we used to say 5 to 10% of breast cancer was related to a single gene or hereditary cancer. Well, that number just keeps growing. And our understanding of vulnerability, you know, whether it be a super high-risk gene or whether it's a more modest influencer in combination with other things, that's really been transformative in the last 1.5 years or so. So now there's a whole suite of genes that we may look at for any woman who comes in with a personal history of breast cancer or a family history of breast cancer to try to better define what is your risk. And it may not be that astronomical 70+% lifetime risk. It may be 2 or 3 times the background. So it would be somebody who might not even be picked up on a radar necessarily, but would certainly change how you were monitored, how with the imaging, your surveillance, and the aggressivity of doing your prevention measures in terms of lifestyle, those sorts of things.
So there are different types of screening modalities out there, and what's the best kind of mix for what type of person? Again, it's the whole issue of individualizing. So the recommendation in this country, besides for the U.S. Task Force's annual mammogram starting at age 40. That's basically it. We have other imaging modalities out there. So the mammogram has been around the longest. It has been the only screening study that we believe has shown an impact on survival. It has limitations. Nobody sitting up here is going to tell you that the mammogram is the best test for picking up all cancers. The thing is that we know that as healthcare providers, we know the limitations of the mammogram. So then we start reaching into our other tools that potentially we might have. The MRI has become a really good test for screening high-risk women. You know, the biggest drawback for MRI, but it is going to find a role going forward, I think. The biggest drawback right now is that it does have, because it's so sensitive and you're picking up these really small things, you're going to be picking up a lot of things that ultimately don't turn out to be cancer. You're going to be doing more biopsies. You're going to be doing more imaging follow-ups. You're going to be doing more other types of imaging to take a look at things. So, you can't really, in good conscience, just throw MRIs out there to everybody for regular screening, because although it's going to pick up 18 in 1,000 cancers that aren't found on mammogram, you are going to be putting a lot of people through unnecessary tests and anxiety of biopsies as well. So you have to kind of be a little bit responsible in terms of who you recommend MRIs for.
When we graduated from medical school, and every year, just like Dr. Gordon said, there's more and more genetic information and tests. And similarly in plastic surgery, there's better and better techniques, better implants, better expander techniques, better, and I will say that you'd be surprised how good those results can look. I mean, they're remarkably good. It's kind of the idea of, well, if someone's A cup breasted and they want to go to a C, they have 100, 150 gram breast mound underneath. And we essentially remove that and we just put a little bit more volume in the implant to account for that. The results are really quite remarkable. And many of our patients say, when you look at, a young woman dealing with cancer and, the reduction in anxiety of worrying about breast cancer every year, mammograms, when you ask them how their psychological health after, they're highly more functional, in the sense that they don't have to worry about this anymore. So to sum up, I just want to say that if you've had cancer, we can fix a lot of problems that have been happening down the road in the past. If you're looking at prophylactic, issues for you or your loved ones, don't be afraid, because I think when you look at our before and after photo sets, they're remarkably, you wouldn't be able to tell that they had mastectomies, honestly.